Hello again, this is Dr. Walker, uh, and talking a little about thromboembolic disease, or PE. Some people call it pulmonary embolus, as it relates to COVID injections, specifically the AstraZeneca version of the vaccine. I find this interesting. I heard about this past week, and I thought I'd talk a little about it and give you my take on it. And again, I do not want to be labeled as an anti-vax or anti-vaccine person. I'm just cautious in terms of putting things in my body that I'm not quite sure how it works. I hear it's safe. I believe the intention is good in terms of safety. I just would like to see this play out a little bit more for me before I actually take the vaccine. So again, I do not want to be labeled as an anti-vax or anti-vaccine person. I think vaccine can be good in the right setting, but new things, new drugs, new medications for me in general, I'd like to see it, trust it, but some personal verification for me is also important. So several countries has sort of pulled away from getting the vaccine delivered to their population, specifically Denmark, Italy, Norway, Iceland, Austria, Estonia, several countries, as you can see listed here. Now, apparently there are 30 cases of severe clotting or PE, pulmonary embolus, as I said before, and 4 deaths. This is as of March the 10th. So 1 death happened in Denmark, 2, for example, happened in Sicily, and 1 happened in Austria as well. So all these countries have said, let me put a pause on this. Now that they're discontinuing the use of the AstraZeneca vaccine, but for now they're saying I'm going to put a 2-week pause on this just to see how things play out long term. So that's kind of where these countries are with it. Now, what exactly is thromboembolic disease or thromboembolism or PE, pulmonary embolus? So this is a cross-sectional image of a person's chest, just about midway through the person's chest. Actually, on my here you can see it about midway here. Can you see my hand? Yeah, probably midway through the person's chest. So these are the pulmonary arteries. So this is the main pulmonary artery. This is the right pulmonary artery. This is the left pulmonary artery. This is the aorta. Sort of the major things in the person's chest. Now, what happens is you get unoxygenated blood that comes into the right part of the heart and then gets into the pulmonary artery, goes to the lungs, it drops off the unoxygenated blood, picks up oxygenated blood and takes it back to the left heart, into the aorta, and then out to the rest of the body. That's the process that's what should happen and what's supposed to happen. So again, the pulmonary arteries are here, takes essentially the dirty blood, the bad blood, takes it back to the lungs. These are the lungs here, the dark part, picks up oxygen, drops off the bad stuff, and takes it to the rest of the body. That's the gist of what should happen. So the white part here that you're seeing is the contrast actually in the pulmonary artery and in the aorta here as well. The dark stuff you see here are actual blood clots. These are the clots that people are talking about. So you can imagine then if this clot is here, then the white stuff, the contrast, the blood, the bad blood cannot get past this thing. So nothing goes into this part of the person's chest. So in other words, that part of the oxygenation process breaks down in that region of that person's chest. So you can imagine then, and here's another part of another little one sort of right here. If you have thrombus, for example, clotting or closing off these areas, you can't get the oxygen that you need to the rest of the body. So essentially, the person is suffocating, essentially, is what's happening. Now, it can get worse. In other words, here's the right pulmonary artery. You can see here, and it's widened here. Do you see that a little bit? It's widened here a little bit because there's blood sort of going in this direction. With the contrast, the white stuff is here trying to get to this area, but it's like a plug that's right here. All of this thing is plugged up. So you can imagine then there's no blood to the right part of the person's chest, which means almost 1/2 of the oxygen capacity is going to be down now because there's no blood leading from the main pulmonary artery into the right pulmonary artery into the rest of the chest for picking up good blood, dropping off bad blood to take to the rest of the body through the aorta. So that's not happening. Sometimes it can also get even worse than this, where there is a thrombus, for example, closing this entire thing off. And you can imagine that's pretty quick death for that person. So again, they can't breathe essentially because they cannot get oxygen, the bad blood to the lungs to pick up the good blood and take it back to the person's rest of their body. So this is a PE, thromboembolic disease, thromboembolism. All of those things are names that we use for PE. So that's what they're talking about in these, in that there is some association, there's some questionable association between some of the vaccines and the cause of this big clot preventing oxygenation from to the rest of the body. That's what they're talking about. So when talking to the AstraZeneca folks, they say that there is no definite link to their vaccine and that big thromboembolic disease that I mentioned before, PE. They say that there's no association. The WHO says that there's nothing to worry about. Nothing to worry about is what they say. Canada and France are both saying that the benefits of the vaccine outweigh the potential risks for badness or for PE or for whatever other thing that might happen. They're saying that there's still a goal with this for now, but as I mentioned before, those other countries have put a pause on their vaccination process, specifically from the AstraZeneca folks. Some other things that I'm tracking on right now, there's 41 cases of anaphylaxis. So these are sort of severe reaction to some vaccine. There is some conversation that many of these allergic reactions, if you would happen to people who typically would have allergies anyway, but severe is very uncommon, which means that this person needs some kind of medical intervention to help them through it. That's one thing. And then you have this other thing, which is called immune thrombocytopenia, or IT, essentially the opposite of the blood clot. So this is where thrombocytes, platelets, cytopenia is decreased. So there's decreased clotting factor in this person. Essentially, this person is bleeding out. So not increased clotting process. This person is actually bleeding out. And there's one person in Florida that died a couple of weeks ago from sort of this exact thing. We get these little red dots in your skin. Those red dots progresses, and essentially you're bleeding in your body, and you succumb or you die from it from that standpoint. So as I said before, I'm not an anti-vax person, but I'm watching the process in terms of what's really happening. Vitamin D is a vitamin that I use, a hormone. Some people would call it a hormone. As I said before, I take about 5,000, usually Monday through Saturday. I take 10,000 on Mondays. On Sundays. Actually, either one of those 2 days, either Sunday or Monday, I'll take 10, and the rest of the week I'll take 5. But check with your doctor. Don't follow what I'm telling you to take in terms of the amount. Check with your doctor, have them draw your blood levels and see exactly where you are, because there's some data that says if your blood levels are high enough, so 30 nanograms per milliliter, if it's high enough, upwards of 60, the chance of you having a problem where you have to get hospitalized or require oxygen, look here. So these are the people with high enough vitamin D levels. They are pretty good for the most part, right? Very few people will have to be hospitalized or need oxygen or anything else. So if your vitamin D levels are high enough, you should be, for the most part, well. Now, there are some people that still have problem with high enough vitamin D levels and still get hospitalized even though their vitamin D levels are high. Usually these folks have some other underlying problem. For the most part, if your vitamin D levels are high enough, you should be okay. But again, check with your doctor, have them check your levels, and they can titrate up to what you need to get your blood levels to be normal. And again, I do this until I'm comfortable taking the vaccine. I'm using alternate ways or other ways of protecting myself and my family. In fact, all of my household, my daughters, my wife, we all sort of take vitamin D, and we're in zinc as well, and quercetin. Again, vitamin D though is the mainstay for me for this part of it, in keeping us all protected to some degree. And knocking on wood, none of us have had any problems with COVID since it started a year ago. So that's the gist of what I wanted to talk about today, and I'll try to get back to those other two things, the IT and the anaphylaxis I mentioned before. I'll try to get a conversation about those two happening here shortly. But that's really what I want to talk about today. If you have anything else that you want to talk with me about, or things that you're using to help yourself through this COVID process, COVID crisis, then let me know in the box below. But otherwise, that's all I have for now. Thank you. Stay well. God bless.